Welcome back to your Feel Good Breakfast Show. It's Expresso right here on SABC3. Now, it is the last day of October, and that also means the last day of Breast Cancer Awareness Month. And I'm sure over the course of the past 31 days, you've been exposed to campaigns somewhere or other in the media, but it is important on a day like today to reflect and ensure that we don't just go quiet on the subject until next year, October. And to make sure that doesn't happen, we're back with Dr. Darren Green, and we're also joined by breast cancer expert with more than 20 years of experience in the industry or the field, Professor Justus Apfelstedt. Good morning, gentlemen. So good to have you.
Good morning. Good morning.
I actually know Professor Justus from my time back at Tygerberg Medical Campus, and I had one of those moments, do you remember me? And he's like, you look vaguely familiar. So good to have you on the show this morning. Let's talk about what this month is all about, breast cancer. I think it's something that really strikes a little bit of anxiety in the hearts of every woman, if not fear. But Dr. Darren Green, what makes breast cancer so prevalent amongst women?
I think if you look at the physiological makeup of women, what separates them from men, it's not just having breasts, because men have breasts too. It certainly is indeed the chemical hormone cycles that they have, and obviously the amount of estrogen. And there are various amounts of cancers that respond or that actually flourish or grow in the presence of estrogen, or that become estrogen dependent. And that's one of the contributing causes.
Are more and more women, Professor Justus, being diagnosed with cancer, or is it breast cancer, or is it the fact that more and more women are going for screenings as a result of the awareness that's being raised around the importance of it?
Screening will not change the incidence of a disease. Yeah. It will bring it to the attention of the medical professionals earlier. We're seeing an increase in breast cancer for two reasons. Women get older, and number two, environmental factors, lifestyle factors are prevalent. Here is especially important obesity, of which we're seeing an epidemic in South Africa. It increases your breast cancer risk by 50%. Lack of exercise increases your risk by about 30%. And then we have other factors like smoking and alcohol abuse that are avoidable. Then we also have other lifestyle changes, postponement of first childbirth. There's a very interesting fact. Breast cancer is directly proportional to the hormonal cycles a woman goes through. And if you look at old societies, Stone Age, 100 cycles in a lifetime, these days modern women go through 400 cycles in their lifetimes.
I think I used to have maybe an idea that you only get it later on in life, but you can actually get it at any time in your life as a woman, right?
That is indeed true, and we are seeing an increase, a small increase in younger women. But predominantly we see the increase in women above the age of 35 to 40 years.
Okay. Well, we are talking about breast cancer and Breast Cancer Awareness Month. This is the last day that we are doing that. Of course, the last day of Breast Cancer Awareness Month. If you have any questions or comments that you would like to give to us, you can give us a call on 021-430-9881. Our experts are here. This is a very safe space, and of course, it's about informing us and making sure that we are informed. So please do give us a call.
It's my Feel Good Breakfast Show.
Absolutely. Well, we are continuing our talk around Breast Cancer Awareness Month, because even though it's the 31st of October, we don't want to end the conversation. We want to keep it going and, of course, continue to raise awareness on the importance of testing and screening and making sure you know what your situation is. Here to help us do that, we've got, of course, our resident Dr. Darren Green in the house and Professor Justus Apfelstedt. And I want to speak about molecular genetic profiling, Professor Justus. Exactly what is involved in that?
Until so far, when we looked at a cancer to determine whether it had the potential to kill the patient, we measured its size, we looked through a microscope at whether the lymph nodes were involved, and we assigned a grade to it, again at the microscopic appearance. I looked it up. The microscope was invented in 1630. Wow. And where in medicine do we still do something like we did in 1630? So we thought that there might be a better way, and we nowadays determine the aggressiveness of breast cancer according to which metabolic pathways are activated in it. And this has allowed us to reduce chemotherapy requirements in certain patients with more than 50%. And so we target our treatment better at women who actually will benefit from it.
Yeah. So what you're saying, this technology basically allows you to decide whether or not chemotherapy is necessary.
Yes.
Wow. That is wonderful, because I know in the past that some patients are often given chemotherapy without necessarily having needed it.
Yes. In the primary treatment of breast cancer, we have to treat very aggressively because if breast cancer recurs, it often ends in a mortality, unfortunately. So the price of avoiding that outcome is very high. And so often people are receiving treatments for 1 or 2 or 3 or 5% benefit in the long term. And that's very hard.
That is very hard.
So you would like to drive up the benefit that more women actually benefit from it and less toxicity is given. Never mind the cost savings by it.
That's incredible. We've got Olga from Johannesburg on the line. Good morning, Olga. What is your question or comment for our experts this morning?
Okay, good morning. My name is Olga.
Hi.
I had a lump in 1988 on my left breast. And it's just after I got my baby, my second baby. Fortunately, it wasn't cancerous. The lump was removed. But now I want to know if there's a possibility that can come back and cause maybe some problems for me with the breast.
Okay, it's very difficult to comment on this when we do not know what kind of a lump that was. Most likely it was a fibroadenoma because at the time you must have been very young. And fibroadenomas do not recur. These days we actually mostly leave fibroadenomas in breast because once we have made the diagnosis via a biopsy that we do with a needle, we can confidently say that this won't harm you, can stay there. Unnecessary operations are being avoided.
Yeah. Well, thank you so much, Olga, for your call. Keep those calls coming. Of course, our number is 021-430-9881. When we come back in our third segment, I really want to talk on something that you touched on, Professor Eustace, is lifestyle and the role that that plays in breast cancer. So stay tuned. We'll be right back.
It's my feel-good breakfast show.
Welcome back to your Feel Good Breakfast Show. It's Expresso right here on SABC3. It's so wonderful to have our experts on the couch, Dr. Darren Green and Professor Eustace Upfelstead. We're talking about breast cancer. Naturally, we're closing off Breast Cancer Awareness Month, but not closing off the conversation. And I said before the break, Dr. Darren, I want to talk about lifestyle because, Professor Eustace, you touched on it. What role does lifestyle play in breast cancer? But before we do that, we've got a caller, Amanda from Cape Town. Good morning. What is your question or comment for our experts this morning?
Hi, good morning.
Hi.
I would like to find out that is someone at high risk after a breast reduction and a hysterectomy, can they be more at high risk?
No, definitely not. Breast reduction reduces the amount of breast tissue and that actually leads to a reduction in breast cancer risk. It is, however, so that a breast reduction introduces scar tissue into the breast, which makes discovery a little bit more difficult. So it's important if you go for screenings like mammography, go to an expert center.
Okay, wonderful. Amanda, I hope that answered your question right there. But onto the topic of lifestyle. How important is lifestyle?
It's massive. I mean, Professor alluded to it early on, a 50% increased risk in breast cancer in people that are obese. And as a nation, us in South Africa really, really need to take cognizance of the fact that more than half our nation is obese. Along with that, obviously, the risk is also increased with a sedentary lifestyle. So sitting being the new smoking, not exercising is big. I think there's up to a 30% increased risk in developing breast cancer with that. And then, of course, the two other lifestyle factors of alcohol and smoking also play a role in increasing your risk. So there's a lot of room for improvement and reducing your risk, a lot that we can actually do.
Wonderful.
Yes.
Talking about what we can do, what can we do on a daily and a weekly basis to make sure that we almost prevent it?
Simply, in South Africa, 10% of breast cancer are discovered by boyfriends. Doesn't say much about the boyfriends or partners. These days, you've got to
Partners,
be
yes.
politically correct.
Yes,
10% are discovered by doctors, 80% are discovered by the women themselves. So sisters, do it for yourself. So on a monthly basis, if you're premenstrual, examine your breasts. There are numbers of instructions available on the web. And if you're postmenopausal, still once a month, when the moon is full or the moon is dark, once a month, examine your breasts.
Make sure that you examine, that's the key in general. At what age should you be going for screenings, though?
Ideally, you would go for annual mammographic screening from age 40 onwards. This is not affordable in systems like South Africa, so you will still have to go for self-examinations, and if you have the means, go for mammographic screening because it's the best way to discover breast cancer early.
Yeah, Professor, I feel like there is I don't know if it's a trend. I think more and more women are doing it, but why do we not do it? Is there a fear around going for these screenings or testing yourself? You'd rather not know.
Yes, this is one big component. Number two, women have all sorts of beliefs, like men have, that are sometimes not reconcilable with the scientific worldview. Then there's fear of radiation, but I can tell you that roughly for every 2 million women that we are saving their lives by early detection due to mammography, we might cause one breast cancer. Then the uncomfortableness of the examination. But there, once again, it's important to visit an expert center because there you have radiographers who are specially trained to make you feel comfortable. And so the examination may be unpleasant for a couple of seconds, but then you're okay.
Absolutely. Well, we always say that knowledge is power, and that's why we have our experts on the couch this morning. We have one more session with them, so if you have a call or a comment, please do give us a call. 021-430-9881 is the number.
It's my feel-good breakfast show.
Very encouraging words. Thank you so much, Nicole, for joining us. We've got one last session with our experts on the couch this morning as we close off Breast Cancer Awareness Month. Professor Eustace, I just wanted to go back to molecular genetics. Can you tell us what the future is for molecular genetics?
It is very exciting to be in breast cancer treatment at this time because we are changing. When I started, it was cut, poison, burn. These days, we are much more targeted, and we are successfully changing breast cancer into a chronic disease like hypertension, treatable, like diabetes, very much treatable. To give you an idea, these days, I think we've solved breast cancer, the survival. But what we are focusing now on is the quality of that survival. To give you an idea, if we diagnose somebody at screening, the survival is going to be the same as any woman that does not have breast cancer. That is how far we can get, and that's the challenge, to bring screening to everybody. Treatment these days is going to be very long, can be up to 10 years, and we must focus on the quality of the survival. That's, for me, the challenge.
Absolutely. We've got a last caller on the line, Anne from KZN. Good morning, Anne. What's your question or comment for our experts this morning?
Good morning. I'd like to know, what about breast cancer in men?
The moves.
Breast cancer in men, I think we should not spend too much time for it. It's interesting for me because it indicates to me that the women in that family have a very high risk of breast cancer, and we examine each and every man for a genetic background in the family, whether this is a familial breast cancer.
All right. Well, we're going to end it there, and I just want to know any final words of hope, like Nicole shared with us so beautifully from you, Dr. Darren Green, with regards to breast cancer.
I think we need to really take cognizance of the fact that this is it's a treatable condition. Early screening and detection is vital. Take responsibility of doing your screening monthly. Same when we look at breast cancer and testicular cancer in young individuals, in men, we need to take ownership of that. And then remember also the association of lifestyle throughout your life and earlier on in your life to reduce your risk.
Yeah. Professor Eustace?
For us, the survival has been solved. Lifestyle, I want to just illustrate this with a couple of numbers. If you are obese, you double your risk of breast cancer recurrence. If you smoke on top of that, you double it again. And if then you drink more than 2 units of alcohol per day, you double it again. So you are responsible for your own health to a large extent, and this effect, for example, of normalizing your weight alone already has the same effect as chemotherapy on your recurrence risk in breast cancer. So take charge of your own health, go for early screenings, and seek out an expert center.
Well, there we go. I think that says it all. Take charge of your own health. Thank you so much, Professor Eustace, for being here, Dr. Darren Green, and of course for continuing this conversation around breast cancer awareness. It's something that should not stop. We need to keep that conversation open. Thank you so much.
Thank you, Leanne, for being on your show.
Awesome.